Hello friends, let us now learn some important points about cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder due to the defect in cystic fibrotic transmembrane regulator on chromosome 7q31.2. This cystic fibrosis transmembrane conductance regulator defect causes defect or mutation. This mutation will cause abnormal functioning of epithelial chloride channels. Okay, so the problem here is in chloride channels, and it also causes defects in potassium channel, that is KIR 6.1 potassium channel, or there can be defect in epithelial sodium channel also. Then if you see the clinical features, we'll see the pathophysiology first. Pathophysiology, if you see in the airways, okay, normally if you see, this is the cell, and normally this chloride is secreted into the lumen. This is the lumen. Chloride is secreted into the lumen and sodium is reabsorbed along with water. In cystic fibrosis case, what happens is there is defect in the chloride channel. So there is no chloride reabsorption, there is no chloride secretion, and sodium is reabsorbed along with lot of water is reabsorbed. So because lots of water is reabsorbed, this shows dehydrated mucus. The mucus will be thick and dehydrated in the cases of cystic fibrosis. Then that is in airways. Then if you see in the sweat glands, it is a little different. So in the sweat glands, the chloride channels, that is cystic fibrotic transmembrane regulator chloride channels, will absorb the chloride from the outside. This is outside, this is the skin cell. Okay, so the chloride is absorbed by the receptor along with sodium, right? So that is normally. In cystic fibrosis, if you see, there is no reabsorption of chloride and there is no reabsorption of sodium. So as a result, there is excess of sweat. Not even excess of sweat. Here there is excess of sodium chloride in the sweat, that is salty sweat is seen. So if we see the clinical features of cystic fibrosis in the respiratory tract, this causes respiratory tract infections will occur. Okay, especially lower respiratory tract infections will occur, and it is caused by Haemophilus influenza and Staphylococcus aureus. Clinical features are Haemophilus influenza and Staphylococcus aureus are the first organisms. Then we also have these are also infected by Pseudomonas aeruginosa, also colonizes the respiratory tract, and Burkholderia cepaceae is a pathognomic organism in cystic fibrosis. Other diseases like bronchiectasis, atelectasis, and even nasal polyps are seen. Then if you see genitourinary system, in genitourinary system it can cause either azoospermia or it can cause infertility, whereas in gastrointestinal system and nutritional abnormalities can also occur. So in gastrointestinal system, if you see the intestine, in the intestine it can cause meconium ileus, or it can cause distal intestinal obstruction, and it can cause rectal prolapse also. In pancreatic, because of pancreatic insufficiency will occur, that is decreased hormones, and there is recurrent acute or chronic pancreatitis can occur. Then we have hepatic. In the hepatic, if you see, there is biliary cirrhosis, or there will be prolonged neonatal jaundice can occur. Biliary cirrhosis, prolonged neonatal jaundice can occur, and there can be nutritional issues like failure to thrive, hypoproteinemia, or even vitamin deficiencies can occur. Then there is also salt loss syndromes are also seen. In salt loss syndromes, there will be syndromes which are associated with salt depletion, and metabolic alkalosis are also seen in cystic fibrosis. Then if you see the diagnostic criteria, there are 3 criteria, that is, one, there should be one or more characteristic phenotypic features should be there. Along with that, there should be a history of cystic fibrosis in the sibling, or there should be positive newborn screening test, result can be there. Along with that, with one of these should be there in the diagnostic criteria. Along with that, there should be one more, that is, there can be either increased sweat chloride levels to be more than 70 milliequivalent per liter on 2 or more occasions. There should be increased sweat chloride level that is more than 70 milliequivalent per liter on 2 or more occasions, or there can be identification of at least 2 cystic fibrosis mutation can also be there, or there can be, or you may demonstrate abnormal nasal transepithelial potential difference. So among these, there should be at least one with one of the previous sections. So that means, if you see, for the diagnostic criteria, there should be either one or more phenotypic features, or history of cystic fibrosis in sibling may be there, or there can be positive newborn screening test. Among these 3, there should be one should be positive. Along with that, among these 3, one should be positive. Then 1 plus 1 positivity is nothing but cystic fibrosis. In this second group, there can be increased sweat chloride concentration more than 70 milliequivalent per liter concentration on 2 or more occasions, or identification of 2 cystic fibrosis mutation, or demonstration of abnormal nasal transepithelial potential difference. Then if you see the treatment of this disease, for this, if there is pulmonary, if there are any pulmonary symptoms, then we can give steroids, bronchodilators can be given, steroids can be given, and you can give hypertonic normal saline can be given, or hypertonic saline can be given, and then you can give aerosolized antibiotics can be given if there is secondary infection. Okay, if there are nutritional because of pancreatic insufficiency, in such cases you can do pancreatic enzyme replacement can be done. You can give a pancreatic enzyme replacement can be done, or you can even give fat soluble vitamin supplementation like vitamin A, D, E, K supplementation can be given, you can give it, or you can give mineral supplements can also be given. Along with that, you will have to treat the bowel complications also. Bowel complications like meconium ileus, intestinal obstruction, then chronic appendicitis, pancreatitis, hyperglycemia, and biliary cirrhosis, all these should be treated. So thank you guys for watching my lecture.